For over 10 years, we've helped Australian primary healthcare professionals achieve significant outcomes from the Australian Primary Care Collaboratives program. We've improved health outcomes for more than 347,000 patients with diabetes and more than 223,000 patients with coronary heart disease. Specifically, more than 35,000 people with diabetes have their blood sugar recorded within recommended limits. More than 34,000 people with diabetes now have their cholesterol recorded within recommended targets, and 34,000 more people with diabetes now have their blood pressure recorded within recommended limits. The APCC program has helped over 400,000 patients to improve their health outcomes. To achieve these results, more than 1,800 general practices and other health services have participated in the program. This equates to more than 4,000 primary healthcare professionals trained to use quality improvement to improve workplace efficiency and patient outcomes.
So how does the APCC program work? The APCC program brings together general practitioners, practice nurses and practice managers to make improvements in a focused topic area. It's based on the Breakthrough Series collaborative methodology, which is a specific approach that is user-friendly and simple. In the collaborative, existing knowledge is distributed to participants from a number of settings who develop and expand and share these ideas to bring about improvements with a common aim. A collaborative starts with the selection of a program topic such as diabetes or coronary heart disease. Then an expert reference panel is formed, which consists of subject matter experts, academics or specialist clinicians, and also those with an expertise in implementing the program in primary care, such as general practitioners and practice nurses. When we've got these two groups together, we develop some aims for the topic, we develop measures that will let us know that the changes being made are leading to improvement. We develop change principles informed by change ideas, which gives participants in the collaborative a rapid head start in improvement. Participating practices attend a series of learning workshops. A GP and another member of the practice team attend the learning workshops at which they learn from experts about practical quality improvement skills. At the workshops, they also share and learn from their peers, those participating in previous waves as well as those in the current wave with them, and this results in the rapid spread of innovation and change ideas. In between the workshops, participants utilise the model for improvement to plan and test changes in small manageable cycles, and they collect monthly data to make sure that the changes they're making are leading to improvements. In the APCC program, we've worked across a number of topic areas now, which includes diabetes, chronic kidney disease, cardiovascular disease, access and care redesign, chronic obstructive pulmonary disease, the prevention of chronic disease and better self-management skills, and we've had specific programs on Aboriginal and Torres Strait Islander health. We find that once people are confident applying the quality improvement skills they've learned, they begin to apply these in many other aspects of their organisation, in the way they develop their work, and it becomes inbuilt into the way they do their work on a daily basis. They become true champions of change and improvement.
We were actually a bit ambivalent about joining the APCC program, as we were pretty confident we already did a good job at caring for our diabetics and cardiovascular patients. That is until we looked closer at our data. I had been scratching around trying to improve the quality of our diabetes register, but we had nearly 10 years of accumulated holiday makers, deceased patients and those that had moved away. And the task of getting useful, usable data always seemed bigger than any time I could allot to it. The APCC program eased us into this and helped break the task into small, achievable steps, and before we knew it, we could see exactly how well we were doing. The APCC program has allowed us to be much more proactive with our chronic disease patients and set up some more structured approaches using our practice nurse and the GP management plan process. We have an elderly population and we have valued improving the processes we have to support them living with chronic health conditions. 7 years after first participating in the program, we continue to use the fundamentals learned for change management in the practice. We continue to monitor our progress and make changes aimed at maximising therapy to improve outcomes for all our chronic disease patients. Additionally, we have used the principles from the APCC program to help us to implement and use e-health and shared health summaries for our patients. As clinical chair now in the current project on chronic kidney disease and cardiovascular disease, we are focusing on risk assessments. We continue to have impacts on minimising risks for our patients. As one recently told me, he's very happy that I'm on his side keeping a watch on things. If all general practices were able to embrace the concept of broader population health monitoring and targeted interventions through improved data quality, interrogation and action, I can see huge benefits to the population as a whole as well as for individual patients. I love the sense of achievement we get in seeing improvements in our numbers from one month to the next. I've been a GP for over 20 years now, and I know there was no capacity for any of this pre-computers. We are now on the cusp of an era where we can start making meaningful use of the information in our systems for the benefit of our patients.
The quality improvement methodology has been successfully used across many industries and can be applied to many different areas of health. In fact, Improvement Foundation has recently applied it for the meaningful adoption of e-health in primary care through the e-Collaborative program. The APCC program has improved the care of hundreds of thousands of patients and empowered primary care practices to improve the way they work. These improvements deliver value for money with better health outcomes at less cost to the health system. For example, we know that investing $1 in primary care saves taxpayers over $12 in hospital costs. The APCC program breaks down geographical and demographic borders. It delivers outcomes to patients regardless of race, age, or location. The impact of the APCC program is one that extends well beyond the life of the program's start and end date. Once implemented, continuous quality improvement becomes a natural way of doing things, providing real benefits to patients long term, which leads to longer and healthier lives.